Hi, my name is Tinu. I'm here to do my tracheoesophageal suctioning. I've already gotten the doctor's orders. I'm going to go ahead and explain the procedure to the patient, and we can get started. Hello, Mrs. Smith. How are you? Good. All right. Well, we got a doctor's order to do some suctioning on your trachea. Okay. A couple of things. When you feel short of breath, you feel tired, you feel you're losing breath, just raise up your left hand for me. Okay. Let me know you're losing breath. All right. I'm gonna go ahead and elevate the head of the bed, which is already elevated, not so much, about 30 degrees elevated, and then I'm gonna go ahead and check my wall suctioning. My hands are already washed. I have my PPD ready to put on before I go ahead and suction. Doctor's orders, sterile gloves, equipment are ready. The doctor's ordered intermittent suctioning, and I'm going to set it already, make sure it works. Alright, I have my suctioning gear right here, the catheter. It works. I'm going to get that ready. Before I get started, I'm going to listen to the patient's lungs. Alright, Mr. Smith, I'm going to go ahead and listen to your lungs now, okay? Alright, take a deep breath for me. Thank you. Alright, I hear some crackles, so it's time for suctioning. I'm going to put that away. Alright. And this is not expired, it's still valid, so I can use it for to clean out my catheter before suctioning. My sterile gloves. Put that right here. It's my sterile kit. I'm going to use my one merging to open this up. What I'm going to do is carefully lift that up of my kit without touching the inside of it. So alright. Okay, I'm going to gently set that down. Alright. Get my kit. I'm going to lift it. Put a little bit of that in there. It's ready for suctioning. And while I get that ready, I'm going to go ahead and pull that aside. And I will push this aside too, so I don't contaminate much. This stays right here. Alright. I'm going to put on my sterile gloves. My hinge margin. Step back a little bit. Put that on. Alright. And then go ahead and get that. Alright. Now I'm sterile. So what I'm going to do before suctioning, I'm going to go ahead and contaminate this end so I can handle the catheter for suctioning, so I can lift up the oxygen before hyperventilating the client after it's suctioning. So, what I need is I need to grab this out of this box. Before I contaminate anything at all, I'm going to grab this, put that away. So I'm going to go ahead and contaminate this end. So I'll get my catheter and go ahead and connect my suctioning. because this is still sterile, I can go ahead and just push it in without touching the blue part of my catheter, suctioning catheter. Alright, it's time to test my catheter for suctioning. So, if that happens, my thumbs are already raised up. Insert, suction, insert, suction. It works. So, I don't need that field anymore, except the normal saline in the box. So, Mr. Smith, we're going to go ahead and suction you now, okay? So, before I go, I'll take that out. I can ventilate the client. He's ready to go. Alright. My thumb is up. Thumb is up. And then insert. When I feel resistance, I go ahead and suction. For 3 to 5 seconds. Go ahead and hyperventilate the client. And then clean out the catheter. Suction. Suction. And let him rest for about 1 to 2 minutes and do the same thing again. Alright, you ready? And while I'm doing this, I'll go ahead and assess my client for any respiratory distress. Insert, fill, and then suction 3 to 5 seconds. And hyperventilate the client. And I clean my catheter. And make sure they're not having any distress, any shortness of breath, anything like that. And I do this for 3 to 5 times. And if the patient is not tolerating it, I shorten my suctioning time so they can have time to rest. And that's the end of my tracheal suctioning. I'll go ahead and lower the head of the bed, hyperventilate the client, and put on the oxygen. Still raise up the head of the bed for about 30 to 60 minutes, and go ahead and clean up. And I'll document, of course, and how much they tolerated the procedure, how much suctioning was needed. And afterwards, I'll go ahead and check the lung sounds to see if there's any more, liquid crackles under it, and see if the procedure was successful. Alright, thank you.